A sling is an essential tool in first aid, used to support an injured arm or shoulder, minimize movement, and prevent further damage while waiting for professional medical assistance. Today, I'll show you how to make and apply a sling properly and why it's such a critical part of first aid. The first thing to know is when a sling is needed. If someone has injured their arm, wrist, shoulder, or collarbone, a sling can provide the support they need. Look out for pain, swelling, or an obvious deformity. In any of these cases, it's important to immobilize the injury to prevent further harm before getting to a medical professional. You don't always need a professional sling to provide support. A simple triangular bandage, or even a piece of fabric like a scarf, can work in emergencies. If you're using a triangular bandage, fold it into a wide strip for stability. Make sure the fabric is strong enough to support the weight of the injured arm. Gently help the person bend their arm at the elbow so that the forearm lies across their body, ideally at a 90-degree angle. Make sure the injured arm is in the most comfortable position for the person, minimizing any unnecessary movement, which can cause more pain or injury. Now, place the center of your triangular bandage under the injured arm. The point of the triangle should face toward the elbow. Pull the two ends of the bandage up and tie them behind the person's neck. The injured hand should be positioned higher than the elbow to reduce swelling. If possible, use a knot that's secure but easy to release in case it needs adjustment. Double-check that the arm is resting comfortably in the sling, with the hand and wrist fully supported. Take a moment to make any adjustments. You don't want the sling to be too tight or too loose. Check the circulation in the fingers by pressing the fingernail and watching how quickly the color returns. This will ensure the sling isn't cutting off blood flow. For additional stability, especially in shoulder or collarbone injuries, you can create a binder using another piece of cloth or a wide bandage. Wrap it around the chest and the arm to prevent movement. This will keep the arm from swinging or shifting, which could aggravate the injury. Remember, a sling is a temporary measure. After applying a sling, it's important to seek professional medical advice to determine the severity of the injury and whether further treatment is needed, like an X-ray or surgery. If the person feels numbness, tingling, or increased pain, the sling may be too tight or incorrectly applied. Always ensure comfort and check circulation frequently. In emergencies where you don't have access to a triangular bandage, items like a t-shirt, towel, or scarf can be improvised into a sling. The key is ensuring that the arm is immobilized and supported while waiting for professional help. That's how you can make and use a sling as part of first aid treatment. This simple yet effective technique can be life-saving in the case of injuries. Make sure you practice and remember these steps. You never know when you might need to use them. If you found this video helpful, don't forget to subscribe to my YouTube channel, First Aid Academy, for more life-saving tips and first aid tutorials. Together, we can make a difference and help educate others on critical first aid skills. Stay safe and keep learning.